Okay, patient preparation for MRI. When a patient comes for MRI, what would be our steps to be followed before starting the scan? So first we will take a consent form from the patient, duly signed by the patient and a co-patient, and we will explain the whole procedure to the patient that what we're gonna do. Okay, and after that we will instruct the patient to remove all the metallic object, including keys, coins, wallet, cards, magnetic straps, jewelry, hearing aids, and hairpins. These should be removed because these are contraindicated for the MRI. And if a patient is claustrophobic patients are those patients which are getting fear when enter to a closed area. So we can provide a staff or a relative or friend of the patient to get inside with the patient and sit with the patient, and the whole time when we are doing the scan, the patient will feel comfort. Okay, we will before injection of contrast, we will explain to the patient that why we are injecting contrast, how we will inject the contrast, what are the benefits and risks for the injection of the contrast. And before injection of contrast, we will check out the GFR, the glomerular filtration rate of the patients. Okay, if it is greater than 30, then okay, we can go for the scan, or if it's lower than 30, okay, then we will go for further management. We will see, or we will do some other steps. Okay, we will give offer earplugs and headphones to the patient for the extra comfort. We will ask the patient, would you like to listen music or some verses of the Holy Quran or whatever the patient feels to listen, to get extra comfort. And this is very important. We'll explain the whole procedure to the patient and we'll tell the patient to do not move during the procedure, because this will affect the whole quality of the scan and will produce motion artifacts. Okay, and we will note the height and weight of the patient. This is important for the patient who needs anesthesia or the patient who need contrast. Okay, first, we will position the patient with the brain or the head first. Okay, this is a patient position and the brain coil. Head first, we plug in the brain coil, and after that, we will take localizer. The three plane localizer. One is sagittal, axial, and coronal. Okay, what is the importance of localizer? On the localizer, we will plan further sequences. Without localizer, we cannot plan the other sequences. This provide a pathway for the planning of the sequences. Okay, we will start from the axials section. So in the axial, we will take T2 axial sequence. Okay, and the we got three localizer. One was sagittal, coronal, and axial. Okay, now we need sequences for the axial, for the coronal, and for the sagittal. If we need axial, we will cover the axial in a box and we will plan on the sagittal and in a coronal. And if we need coronal, we will cover the coronal in the box and we will plan on the sagittal and axial. And if we need axial, we will sagittal, we will cover sagittal in the box and we will plan on the coronal and on the axial. Okay, here now the axial is covered in the box, means we need axial. Okay, this is the corpus callosum. This is the corpus callosum, and this is the genium, and this is the splenium of the corpus callosum. Our planning should be parallel to the genio and the splenium of the corpus callosum. See, one part of our planning, our slice is attached to the genium and other is to the splenium of the corpus callosum. This is the planning of axial on the sagittal. Okay, parallel to the corpus callosum or the geniosplenum of the corpus callosum. And the coronal, how we would plan for the axial, this is the fourth ventricle and this is our planning. Our planning should be perpendicular to the fourth ventricle of the brain. If we draw a line from the top to the bottom, this is a fourth ventricle, and this is the line. Okay, and this is the fourth ventricle and this is a line we draw down, and this is our planning. So it is making a 90-degree angle here and here. This will be our planning perpendicular to the fourth ventricle. Okay, and this will be our final image. Okay, here keep one thing in your mind. that when we are taking axial sequence, our slice should be sufficient to cover the entire brain from the vertex to the foramen magnum. This is the foramen magnum at which the spinal cord is entering to the brain, okay, which is the entry point between the brain and the spinal cord. So our planning should be sufficient. Our slices here must be slices this, okay, and this slices from the top of the skull, and this is the vertex, and to the entry point of the foramen magnum. These are axial planning. T2 axial. Okay, now any axial which is coming onward, we will copy this plane and will paste on that. Okay, this is T2 axial. We will take this plane and will copy on T1 axial, because this is axial series. The planning is same. What we will do for another one, this is flare and axial, sorry, not T2, only flare axial. Okay, this is mistakenly been put it here. Okay, flare axial. On the flare axial, we will copy the same planning of the T2 axial on the flare. Another one is diffusion weighted images, but still axial. We will copy the axial T2 planning on the diffusion weighted images. That means that the planning for the diffusion weighted images, planning for the flare axial, planning for the T1 axial, and planning for the T2 axial is same. All the axial planning are same. Now let's move to the coronal. And the coronal, now we need the coronal images. So the coronal is covered in the box, and we are planning on the sagittal end and the axial. Okay, in the coronal, our line, this is corpus callosum, okay, and this is the midline of the brain. And the coronal, our planning will be perpendicular to the corpus callosum, and the axial it was parallel, but here in the coronal it will be perpendicular to the corpus callosum. This is corpus callosum and this is perpendicular, and here will be more slices here and here, okay. And in the axial, for the coronal, which we are planning on the axial, our planning will be perpendicular to the midline. Okay, this is the midline of the brain, and our planning is perpendicular, and this is the required image. Now, any coronal which is coming onward, we will copy and place and paste the planning. T1 coronal, T2 coronal, the same planning we copy and paste it and paste here. Okay. Now let's move to the sagittal, and the sagittal, the planning will change. Okay, but keep one thing in mind, that when we are doing the planning for the coronal, how much will be our field of view, if we mean the starting and the ending point of our slices. Okay, the number of slices should be sufficient to cover the entire brain from the frontal sinus, okay, here and here, from the frontal sinus to the line of the occipital protuberance. This is the occipital bone, and this is the protuberance of the occipital bone. So this the whole brain should be covered. Okay, let's move to the sagittal. And the sagittal, you can see here, this is the midline. Okay, this is the midline, and this is our planning. So the midline and our planning on the axial for the sagittal will be parallel to each other. Okay, now here the required planning is the required sequence is sagittal. We need sagittal, okay, and we will plan on the axial and on the coronal. Okay, so this here our plan will be parallel to the midline, and here also this is a midline. On the coronal, our plan will also be parallel to the midline, and make sure that the number of slices is sufficient to cover the entire brain from the one temporal lobe to the other temporal lobe. Okay, this from one temporal lobe to other, this is from one temporal to other temporal lobe. This is the planning for the T2 sagittal. Now if any sagittal is coming onward, we will copy and paste the planning on that. This is T2 sagittal, this is T1 sagittal, same planning we copied and paste here. Okay, If the patient need contrast, like some tumor or something else or abscess, then we will inject contrast to the patient. For the injection of contrast, before injection of contrast, necessary to take T1 sequences, T1 sagittal, T1 axial, and T1 coronal. This is very important before injection of contrast. Okay, sometime we are not taking some sequences in axial if no need contrast, but if need contrast, before injection of contrast, T1 axial, T1 coronal, and T1 sagittal. This is very important. Okay, and after contrast injection, we will again copy and start T1 sagittal after contrast, T1 coronal after contrast, and T1 axial after contrast. Why we are taking T1 coronal before contrast and T1 after contrast, T1 axial before contrast and T1 axial after contrast, T1 sagittal before contrast and T1 sagittal after contrast, because for the comparison. Okay, is there any enhancement before after contrast or not? If there is any tumor, as the tumor are enhancing after contrast or not? Okay, so for the contrast comparison, we are giving contrast. Okay, and these are the final images of that we plan. This is the axial T2 images. Okay, starting. These are the axial images T2. These are the flare images. Okay, axial flare, and these are the T1 coronal images, and this one is the sagittal T2 images. This is the images after contrast. You can see the contrast over here. This in the veins, you can see the contrast. Okay, here superior sagittal sinus, the transverse. You can see the contrast here. Okay, this is T1 coronal images after contrast, and these are the T1 axial images after contrast. You can see the contrast here, the hyper intense areas. Okay, here you can see this area here. So these are the images after contrast. Thank you so much for listening the lecture. I hope so you get a good idea about the brain MRI. Goodbye.